So it is maternity nursing, right? So in maternity nursing, basically, we are going to talk about the sign of pregnancy, then what are the expected discomfort during the pregnancy, the way of calculating the fundal height is called GTPL, and also we are going to talk about the different tests, what we have to do during the antepartum care, and also different kind of complication mother has to face. So let's go and start one by one. So here we said the here if you go, the picture is showing the reproductive system of the female. So reproductive system basically consists of fallopian tube, and this is the fallopian tube, ovaries, uterus, and external genital organ. The ovary secrete the ovum, and when ovary fertilized by the sperm, then zygote form, right? Basically, the zygote of formation in the fallopian tube, then it is transmitted from fallopian tube to the body of the uterus, where the zygote fertilized. So in this picture, showing the different part of fallopian tube, like this is the ovary, this is called fimbria, infundibulum, and this is called ampulla, right? Isthmus, and this is the body of the uterus. And here showing the pelvic beam. The pelvic beam is made by two lateral hip bone, and on the posterior side the sacrum, and anterior side the meeting point of pubic symphysis, and this it is called inlet of pelvis. And here is showing another specimen showing the pelvic beam, inlet and outlet. And now I'm just going to talk by systemic way. The first one here, what are the primary sign of pregnancies, right? What are the primary signs? So the pregnancy sign we can categorized by three ways. One is called presumptive sign, probable sign, and positive sign. This first one is presumptive sign. These signs are not 100% accurate, or means the primary sign or presumptive sign, it does not mean the mother is going to get pregnant and will be give a birth or delivery. So presumptive sign, basically, this is can be explained by the other condition as well. So amenorrhea. So amenorrhea is the first or primary sign of pregnancy, but amenorrhea does not mean mother is pregnant. There's so many causes of amenorrhea as well, right? Amenorrhea means stoppage of menstruation. And also mothers sometimes complain of nausea and vomiting, or urinary frequency, or breast change, urinary frequency, and mother feel easily fatigue and quickening, right? So basically, amenorrhea increase the level of HCG. HCG means human choriogonadotropin hormone. And other said, the breast change usually result into the signs, tenderness, and darkness of the areola. And why the urinary frequencies increase? Because enlarge the uterus, what is put extra pressure on the bladder, right? And quickening, as I told you, the mother can feel the movement of the baby's limb or upper or lower extremities. So, first of all, mother feel abdominal fluttering and felt by 18 to 20 weeks. So, when mother can feel the movement or quickening during 18 to 20 weeks of pregnancy. Definitely, uterine enlargement is also presumptive sign. What else? So here showing the sign of pregnancy in a picture, and picture can talk, right? So mother can feel at the early dizziness or nausea and vomiting, tenderness, tender on the breast, or heaviness or fullness, easily fatigued and tired, right? And mood switching. So in that stage, mother must need the mental support, courage, all right, and also frequent urination because the uterus give a pressure on urinary bladder and increase the sensitivity to smell and also the stoppage of menstruation period. So, as I told you, another terminology you must know or you should know that if at the early stage the mother complain of nausea and vomiting, and this is very common sign, nausea and vomiting. But if mother complain the excessive amount of nausea or vomiting, that is not normal sign, right? In the PowerPoint, we will also talk about the some abnormal sign like supine vena cava syndrome. We will discuss maternal phenylketonuria, what it is, iron deficiency anemia, candidiasis, or any other transmitted disease. We will discuss the lab investigation part. So next here, the probable sign. What are the most probable sign of pregnancies? Here, most probable sign I said. Probable sign means probably related to the pregnancy, right? More accurate sign this one. What they are? First of all, uterine enlargement. It is the most probable sign. Uterine enlargement occur irregularly at the beginning. Uterus above the pubic symphysis by the 12 weeks and reach umbilicus by the 20 to 22 weeks. So in this picture, you can see the height of the fundus by week, right? It is also the probable sign. So at the beginning or at the 12 weeks, if you palpate the uterus, you can feel the uterus just up of the pubic symphysis. During the 16 weeks of pregnancy, uterus in halfway in between pubic symphysis and umbilicus. This is the umbilicus, this is the pubic symphysis. During 16 weeks of pregnancy, uterus is in between umbilicus and pubic symphysis. During 20 weeks, the fundus of the uterus just around the umbilicus, right? And during 30 2 weeks, it is in between umbilicus and Giffroid process, right? In between Giffroid process and umbilicus. At 36 weeks, the height of the fundus just touch the Giffroid process. But you see, during 40 weeks, it is not touch the Giffroid process. It is just little below, because the uterus is expanded side to side and height is little bit go down. So fundal height is the most probable sign of pregnancies. So what are the other signs of pregnancies? We call probable sign, like Hager sign. What is Hager sign? Softening of the lower uterine segment, and occur, it is 2nd to 3rd month of pregnancy. So if the lower uterine segment is softened, it is called Hager sign. But if the cervix of vagina is softening, this is called Bdrl sign, right? The other sign is called Chadwick sign. This is the bluish discoloration or purple discoloration of the cervix. And another sign is called ballotment. It is rebounding of the fetus. Again, examiner fingers on palpation. So irregular, painless contraction throughout the pregnancy. This is called Hicks contraction. So this Hicks contraction are irregular, painless, right? And this contraction throughout the pregnancies. And definitely this is the sign of probable pregnancy sign. Abdominal enlargement, more rapid after 12 weeks. Abdominal striae, this is the stretch mark because of pregnancy. Skin pigmentation, like nipple become darkened, areola bigger size, hormonal change, linea nigra developed, both are probable sign of pregnancy. So now go and see in the picture. This is the structure of the uterus, ovary, fallopian tubes attached with the uterus. This is the body of uterus. This is to muscle layer, myometrium layer. This is the fundus, right? And this is called cervix. So, as I told you, the probable sign, most probable sign is the Hager sign, right? What is Hager sign? Softening of the uterus. It is called Hager sign. Softening of the cervix, this area is called Bdrl sign. And blue discoloration of the cervix and vagina, this is called Chadwick sign, right? So all of them are early physical sign of pregnancy we call probable sign. What the other probable sign? Bexton Hicks contraction or positive abdominal enlargement, abdominal striae, all of them. So what next? Next is positive sign. Mother is 100% sure she is going to give a birth or delivery after certain period. So it is called most positive sign. Definitively pregnant. Mother is definitely pregnant. So the most important, the fetal heart sound. If you put the stethoscope, we can feel, we can count fetal heart rate. Fetal movement can felt by the provider. right? The healthcare provider can also feel it. And also visualization of the fetus by ultrasound. One is the fetal heart rate, fetal movement, and ultrasound. So ultrasound is the most accurate to identifying the positive sign. Fetal movement, NCLEX board sometimes asks when you can feel or when you can count or measure the fetal heart rate. Maybe heart at 10 to 12 weeks by the Doppler. Maybe heart through regular fetoscope 18 to 20 weeks. Normal heart rate in case of infant 120 to 160 beat per minute, whereas the normal adult it is 60 to 90 beat per minute. Fetal movement felt by second trimester. And ultrasound, what are the most important to identify? Visualization of fetus on ultrasound. At the 6 to 8 weeks, fetal identification should be positive, an early positive method of diagnosing the pregnancies. In this picture, you can see the ultrasounding of uterus, right? And we can see this is the baby's head, extremities, and bodies. What next? And here a picture showing what are the most expected sign of pregnancies, right? Expected sign or expected physiological change during the pregnancies. So it is very important basically. So if you see the picture, you can see the first of all the breast tissue showing the mammary gland. This is the non-pregnant. Mammary gland is very small, and the pregnant uterus, the mammary gland is bigger. But in here, the mammary gland is full of milk, and your nipple is bigger size. So in this picture, you can see the pregnant or lactating breast tissue is bigger and tender, and mother can feel heavy, and areola also get bigger. So here in this picture showing what are the expected change during the pregnancy. This small picture can talk. How? Like this is the lungs, means respiratory system. This is the GI, gastrointestinal system. This is the heart, cardiovascular system. This is the mammary gland. And this one is the endocrine gland. And this is the abdomen, urinary system, urinary bladder, ureter, kidneys, and musculoskeletal system, and intragumentary and other changes. So cardiovascular system, if we go, what are the expected physiological change during the pregnancy? So cardiovascular change usually increase in cardiac output, and blood volume increase 30 to 45%, heart rate increase. Respiratory system, basically oxygen need increase, lung capacity decrease, and respiratory rate increase. What about the endocrine system? Endocrine system, the secretion increase. What about the urinary system? As I told you, increase the frequency of urine. What about the cervical chain? Cervical chains become softening and blue, purple color, the cervix. The breast tissue here, the larger the breast, darker areola. And what are the intragumentary system or skin? Mother develop the colosma. It is the brown discoloration of the face. Linea nigra, also striae develop. So we have another picture. It is showing the skin changes during the pregnancy. And this one is called the colosma. So this is, you can see the brown discolor or pigmentation on the face. And this one is called linea nigra. This is the linea nigra. So the line that runs from navel to the pubic bones, along the pubic bones. This is linea nigra. And this one's called striae gravidarum. So it is the stretch marks often present during the pregnancies. So so now we're going to talk about how to calculate the due date and fundal height, and also what are the meaning of GTPAL. What are the meaning of GTPAL? So basically, it is important we have to know how to calculate the due date or calculating the due date. Basically, we have to add the 9 months plus 1 week from last menstruation period. So fetal height, I will explain few minutes ago. This is the fetal height. Fetal height means measure from the pubic symphysis to the top of the fundus. To the top of the fundus. The fundal height equal to the gestational age. Fundal height equal to the gestational age. Sometimes NCLEX board asks the question from GTPAL. What is GTPAL? So G stand for gravidity, right? Gravidity means the total number of time the pregnancy. So total number. So if mother going to give a birth first time, right? If the mother have already 2 baby, now she is going to the another birth. This is the 3, primigravida or multigravida. So G stand for gravidity, and gravidity stand for the total number of pregnancies. And T stand for term birth, right? So the number of the birth at 38 weeks or more. And here the P stand for preterm birth, preterm. So birth at less than 38 weeks. So T stand for term birth and full term birth at 38 weeks or more. Some book wrote 37 weeks. P stand for preterm, means the birth at before 38 weeks or before 37 weeks. A stand for abortion or miscarriage, right? Also, it is important you have to know if mother want to terminate the pregnancy before 20 weeks, it is abortion. If mother try to terminate the pregnancy after 20 weeks, it is no more abortion, because the infant become a person, and that times it is homicide. It is killing, illegal. So sometimes when you work as an RN in gynecology or obstetrics, in some medical situation, you have to know ethical dilemma, right? Like your patient is 16 years old. It is minor, right? Like parents want terminate for the pregnancy, but 16 years girls want to be continue the pregnancy. In that case, the 16 years girls have a right to take the decision, and this is called emaciated minor. So as I told you, as a RN, you have to know what are the ethical dilemma. In that kind of situation, you have to give the priorities your patient what said. Another example, like a boy, he is 17 years old and want to participate in US Army. He is emaciated minor. A boy or a girl below 18 years old who's minor, but like he or she is diagnosed by sexual transmitted disease. The parents with them, doctor when counseling one-to-one, patient request to doctor, don't share with my parents and give me the medication, I will continue. In that case, these boys or girls are emaciated minor, right? So sometimes NCLEX would ask, what is emaciated minor? When even in what situation ethical dilemma will have to apply. So L stands for current living child. So or else is the living children. As an example, here showing GTPAL are 4, 1, 1, 1, and 2. G stand for gravida. So gravida 4. So mother already 3 times got pregnant. And T stand for 1 means one delivered baby is a full term. 1P, P1 means one baby preterm. 1 is term means more than 38 weeks. 1 is born before 38 weeks. And A for abortion. So out of 4 pregnancies, mother did 1 abortion or miscarriage. And L means current living birth. So 2 are still with mother. They celebrate their birthday. So 2, 1 is abortion 3, right? And it is die. And 1 out of these 2, 1 was a full term, 1 was a preterm, and 1 is the current. So it is total 4. Let me read the explanation. A woman is pregnant for the 4th time. She had 1 abortion and 1 daughter who was born 40 weeks, means more than 38 weeks. So it is a full term. Son or son who was born at 36 means birth before 38 weeks of pregnancy, so it is preterm. And 1 son born 38 weeks preterm, and abortion is 1. Abortion is counted the gravity, but is not included in the parity because it occurred before 20 weeks. Living child is 2 here and carry the past 28 weeks of gestation where or not the fetus was born and alive. Therefore, the parity for this mother is 2. So what next? Okay. So now we are going to talk about the prenatal care, right? During the prenatal care, we can categorize it as prenatal history and prenatal physical assessment. So during the when a mother go to the um, outdoor or hospital in obstetrics unit, then as a RN, you has to take the history from the patient, and good history can exclude so many physical problem about the patient. So when you take the previous or past medical history, past gynecological or obstetrics history, if mother are the high risk, you easily can find it out and give them extra care if they need. So prenatal care is the important, very important for the mother and for the baby. And in that time, we have to do so many important laboratory tests. So this is the prenatal diagnostic test or lab values is important in that age group and that times basically. And also you have to examine the mother, right? Thoroughly examine in systems by system or the fetus as well if it is more than 28 weeks. So during this during this test, we have to do some physical examination, some laboratory examination. Like first trimester, we allow mother to do complete blood count. It is called CBC, blood type and scanning, rubella scan, HIV, urine microscopic examination, right? So as an example, we have to do the complete blood count because to check the RBC count. If mother has less RBC, we can find out anemia. If mother has the anemia like iron deficiency anemia, we prescribe iron tablet. Same CBC can exclude the total count of WBC. If we can see WBC is less than normal or more than normal, it is indicate the infection, indicate the leukopenia or leukocytosis. Leukopenia, if mother have, so mother frequently attacked by infection or fever, it is important to prevent the infection. Also, it is including the thrombocyte, platelet or thrombocyte. If the platelet is less, it would be indicate of the bleeding. We need special care to the mothers. Like the blood typing is important. If mother need the blood transfusion, we has to be ready. So need the blood typing or scanning for RS factor. RS factor is very important. It is indicated by the COM test and determined if mother is RS negative or RS positive. For RS negative patient, repeat at 24 to 28 weeks and admin the RHO GAM at 28 weeks. This is the question NCLEX board asks, right? So same as we have to exclude the sexual transmitted disease like HIV. right? Also, we have to find out any other problem like, or if mother have any group B staphylococcus infection, or we have to do for glucose tolerant test as well. So urine analysis indicate the kidney functioning or not, or any other infection as well, or blood sugar or ketone body. Electrolyte is very important, sodium, potassium, or other electrolyte. VDRL. VDRL stands for Venereal Disease Research Lab. This is the shortly called Bdrl test. So Bdrl test is very important to find out any syphilis, gonorrhea, or any other sexually transmitted disease. Easily can find it out, or even it can find out any infection, right? Any infection, especially sexually transmitted infection. So TB skin test for the tuberculosis, hepatitis B, most important, urine culture and sensitivity. If mother need any kind of antibiotics during this time, we have to be prepared if mother need, right? And also in the second trimester, we have to do the glucose tolerant test. It is called glucose tolerant test. So shortly called GTT. So level, if more than 135 milligram per DL, need follow-up, right? Need follow-up. So glucose tolerant test taken at 24 to 26 weeks, and no fasting, because this is the glucose tolerant test. If the result is more than 135 milligram per DL, but some books said it is more than 140 milligram per DL, it indicated. And mother need follow-up, right? Require follow-up with 3-hour glucose tolerant test, and fasting required for 3-hour test, right? So also other most important tests are maternal serum alpha fetoprotein, shortly called AFP, alpha fetoprotein. So alpha fetoprotein can detect neural tube defect or can defect Down syndrome, right? So if alpha fetoprotein is increased more than normal, indicate neural tube defect. If alpha fetoprotein less than normal, indicate Down syndrome, baby born with Down syndrome. So basically, alpha fetoprotein taken at 15 to 22 weeks to scan for Down syndrome or neural tube defect. Easy way to remember, when it is less means Down syndrome. When alpha fetoprotein is high, indicate neural tube defect. So how we have to prevent the neural tube defect? Tell mother to take folic acid. Folic acid or fortified food can prevent neural tube defect. In the third trimester, we can do for Std Scan, means sexual transmitted disease, right? Group beta, another test, group beta Streptococcus. If positive, we give them penicillin G. So group B, Streptococci. we have to take the vaginal or anal culture taken at usually 35 to 37 weeks. If positive, give them penicillin G. It is the antibiotics. Also, if you go in the doctor office to see if any sign symptom, they can give us any other test. Is called STI. STD means sexual transmitted disease. STI means sexual transmitted infection like gonorrhea, chlamydia, syphilis. Also, we do the PPD. PPD means tuberculin test or touch, TORCH. Okay, so this is the very basic test. Usually we have to do for or during the first trimester, second trimester, or third trimester, right? So as I told you, if we see iron deficiency anemia to the mother, we have to give them or encourage intake iron containing food like meat, green leafy vegetables, fruits, banana, right? So same as here, we said like if the sexual transmitted infection, STI or STD, we have to check for chlamydia or gonorrhea. Otherwise, this bacterial infection that are often asymptomatic, means mother have the chlamydia or gonorrhea, but no symptom. If asymptomatic, easily to transmit from mother to the baby and causes a big problem. So if asymptomatic can lead to pelvic inflammatory disease, even is shortly called PID, right? Definitely, if you take the treatment or treat it with an antibiotic, it will be okay. All infant administered erythromycin after delivery within 1 to 2 hours to prevent ophthalmic neonatorium, right? Same as if we see the syphilis, we give the treatment. If we see the HPV, we give the treatment, or trichomoniasis, we must give the treatment because we don't want mother has to continue this one. Like group beta streptococci, if positive, give them penicillin G, right? So you, what are the tests we have to do for group B streptococci? Vaginal or rectal culture during take 35 to 37 weeks. So if mother diagnosed positive group B streptococci or beta hemolyticus, provide intrapartum antibiotic like penicillin or ampicillin for the mother with positive GBS, right? So it is very basic information. It is, I love to request you, if you know, this is so good. So now also it is important during the delivery or during the antepartum care, we have to take or we have to measure the total body weight. So total weight gain, okay? Definitely when a girl became a pregnant, their body weight gain and gain of 25 pounds is average, right? So weight gain, as I told you, total weight gain should be around 25 to 35 pounds. okay, during the first trimester. And after the first trimester, means second or third trimester, mother body weight is gained 1 pound per week for second and third trimester. Let me actually redo it. I'm talking about here, body weight. So the total body weight should be 25 to 35 pounds will gain during the first trimester. After the first trimester, means second and third trimester, 1 pound per week mother will weight gain, right? So when you will say overweight women, if the pound is more than 15 to 25 pounds, and when you say underweight women, if it is 28 to 40 pounds. So basically now go the second is called the nutritional status. Nutritional status. So nutritional status basically 2,200 to 2,300 calories per day. Same thing I want to tell you, 2 liters to 3 liters, right? So calorie, no additional calorie during the first trimester, but 340 extra calorie during the second trimester, or 462 extra calorie mother need during the third trimester. So what about the fluid? Mother need 2,000 milliliter of fluid per day, right? Increase the protein intake, increase the iron to decrease the anemia. It's called iron deficiency anemia. Also increase the folic acid to prevent the neural tube defect. And if mother are breastfeeding, they need some extra calorie. Extra means extra 450 to 500 calorie per day mother needs, right? So sometime we need to know how to calculate the expected date of delivery. We has to calculate the expected date of delivery by the Naegele's rule, right? Naegele's rule. So Naegele's rule, basically, we has to, if this rule is applicable if the mother has a regular menstruation period. We has to find out what are the last day of menstruation. Then fix that date, add 7 days to the first day of last menstrual period, then minus 3 months and add 1 year. Okay, what I did to remember, write down the last day of menstruation period, like August 9, 2010. Add 1 year first, means August 9, 2011. Add 7 days, 9 plus 7, right? Okay, so minus 3 months from this date. Okay, simply. So add 1 year, then add 7 days minus 3 months. Okay. And before to go next level, I want to recap it about something nutritional status. They should increase the folic acid to prevent neural tube defect. So always we have to encourage the mother to take folic acid containing food. If any problem, we give them fortified food that contain the folic acid. Usually recommendation 600 microgram per day, and also increase the protein intake, right? And iron supplement, iron increase to decrease the anemia. Also increase the vitamin C, because vitamin C increase iron absorption. Also, mother need calcium. Calcium needed for bones, for dental or teeth formation of the fetus. Okay, and fluid intake is recommended 2000 ml or 2 liter to 3 liters per day. Ml, milliliter. If you convert to liter, it should be 2 liter. So caffeine intake should be limited. Caffeine, no alcohol, because alcohol causes a big problem to the babies. So here the normal, what are the normal pregnancy discomfort in each trimester, right? So basically this is the discomfort for the mother, right? But this is the expected discomfort and is a normal sign, right? So here we go, the first trimester, usually nausea and vomiting, increase the frequency of urine, breast feeling tingling, right? So it is important, we have to know that the nausea and vomiting is the first trimester, it is normal. But nausea, vomiting will disappear in the second trimester or third trimester. If the nausea and vomiting is continue, the second or third trimester, or excessive nausea and vomiting that last more than 12 weeks gestation, this is not good. And that one is called hyperemesis gravidarum, right? So as I told you, if mother have a nausea and vomiting in the first trimester, especially in the early morning, tell them to eat dry food like dry toasted or crackles before get up in the morning. Also, I mean, give them some dry food before washing their mouth or teeth. And increase the frequency of urine or urination. So it is actually empty the bladder frequently. Sometimes some type of exercise can help. And tell mother to perform causal exercise for stress incontinence. Okay. And in that times, UTI or urinary tract infection, also common. If we see any sign symptom of UTI, like burning sensation of urine, lower abdomen pain, we have to notify the healthcare provider. Or sometimes mother complain the cloudy urine or foul smell urine. It indicate UTI. UTI stand for urinary tract infection, right? So second trimester develop constipation. So if mother develop constipation, it is good tell them to intake the fluid and fiber content food. Heartburn also discomfort the second trimester. Heartburn tell them to eat small frequent meal and sit upright after meal for 30 minutes or more. And also pigmentation, I mean the linea nigra become prominent. And sometimes mother complain the leg cramping, I mean leg pain. Okay. And also I said that third trimester, mother continue to complain leg cramping, hemorrhoid, right? If mother complain the hemorrhoid, tell them to use warm sit bath or also what's the some hazel pad. Sometime in the third trimester, they complain the varicose vein or low back pain. Varicose vein means the elevated leg or where the support hose or walk frequently and avoid prolonged standing. Varicosity of the vein. And sometimes mother complain gingivitis or congestion, even epistaxis. So practice or educate mother good oral hygiene, use normal saline if congestion, right, or spray with humidifier. So this is the common discomfort for the first, second, and third trimester during the pregnancies, right? Now here we said, what are the reportable danger signs? So in what disease sign symptom we has to inform to the doctor or healthcare provider what they are. So reportable danger sign. If mother has suddenly vaginal bleeding or lower abdominal pain, epigastric pain, or visual disturbance, very severe persistent headache, change in the fetal movement after quickening, or if the fetal movement is absent, we have to inform healthcare provider. Or if mother complain the painful or burning urination, UTI, right? Pregnancy induced hyper edema or edema on the face, feet, or hand, or sudden rush of the fluid, or rupture of the membrane is called pregnancy induced premature rupture of the membrane. So elevated the temperature above the 101 indicate infection. We have to inform healthcare provider. Persistent vomiting or absence of the fetal movement after quickening. Very important for NCLEX board. Now going another is super important for NCLEX board. This is called high risk monitoring. High risk monitoring, right? So if mother or the baby under the risk, how we have to monitor? Listen me very carefully. It is very important. So if mother or baby under the high risk, we have to examine or do some test that can save for the mother and for the baby. The first test is called chorionic villus sampling. Chorionic villus sampling. So what it is, or when is it done, or key advantage of this procedure, and what are the complications? We have to know. Okay, so chorionic villus sampling, basically it is the chorionic villus means the tissue inside the placenta, right? And placenta is surrounded by the amniotic fluid. Everybody know that. So chorionic villus sampling means portion of the placenta is aspirated through the catheter or syringe to assess for chromosomal abnormalities. So ultrasound guided catheter or syringe is passing, collect the tissue from the placenta and analysis for chorionic or chromosomal abnormalities to exclude the chromosomal abnormalities. So when we perform this test, we can, or we perform at 10 to 13 weeks of pregnancy. Perform at 10 to 12 or 10 to 13 weeks of gestation, right? So in this study, we perform and excluded to detect any genetic disorder or chromosomal abnormalities. So the chorionic villus sampling has some key advantages and also some complication. You have to tell your patient about the complication and advantage. First of all, go for the advantage. Provide early diagnosis of abnormalities. Provide the early diagnosis of chromosomal abnormalities. It is the advantage. Then amniocentrisis. Amniocentrisis do during the 14 weeks, but chorionic villus early 12 weeks. So if any abnormality is found, if parents want, they can terminate the baby or pregnancy. The complications are the it is called chorioamnionitis or perforation, rupture of the membrane, or chance of abortion or miscarriage. So this is the common complication of chorionic villus sampling. The second test we should do is called amniocentrisis. So what it is, we have to know, and what is it done, and what are the interpretation of the result, and what special care patient need, and also what are the complications. Amniocentrisis, basically amniotic fluid is aspirated under ultrasound guided. So basically uterus contains the placenta. Inside the placenta, fetus is there, and fetus is floating or covered by amniotic fluid. So needle is passing under ultrasound guided, collect the tissue for analysis. This test usually performed after 14 weeks, right? So, and rule out any congenital anomalies or chromosomal abnormalities. The other test is called alpha fetoprotein, shortly called AFP, alpha fetoprotein. So alpha fetoprotein high level associated with neural tube defect. Alpha fetoprotein low level associated with chromosomal abnormalities like Down syndrome. And this test also done at 14 to 16 weeks. The other test is called L and S ratio. L and S, lecithin surfactant ratio. So usually L and S ratio is 2:1. 2:1 indicate the lungs maturities. So 2:1 ratio indicate the fetal lung working well. If this ratio is not like this, indicate the lungs is not mature, so baby are not able to start respiration. They need special care. So if what care basically they need, so have the patient empty the bladder prior to the procedure for chorionic villus or amniocentrisis, because the amniocentrisis, when you collected, same time you can see the alpha fetoprotein or lecithin surfactant ratio. So before the examination or lab test, how you have to prepare your patient. They have the patient empty the bladder prior to the procedure. After procedure, administer rhogram to Rh negative mother, and also encourage rest and plenty of fluid for 24 hours. So if mother do the amniocentrisis, there's some complication. It's called amniotic fluid emboli or hemorrhage, infection, leakage of amniotic fluid, premature rupture of the membrane. Chorionic villus sampling also causes the premature rupture of the membrane. Another most common test, everybody know that, is called sonogram. Sonogram means ultrasonography. Ultrasonography, right? So sonogram determine the fetal and placental position. So what is sonogram or ultrasonogram? What are the indication and what preparation patient need? We should discuss about that. Sonogram or ultrasonogram diagnostic procedure using high frequency sound wave to visualize the developing fetus. An indication confirm the pregnancy or site of implantation or assess the fetal growth, development, and movement, right? Even fetal sex. So how you have to prepare a mother for sonogram? So have the patient drink 1 quarter of water prior to the procedure, right? So before the test, better tell the patient to drink water, right? Another most important examination we have to do for the patient are called biophysical profile. Biophysical profile, right? Biophysical profile, basically what it is or what are the scoring system. So biophysical profile is a 5 assessment test to determine the fetal well-being. Each has a possible score of 2 and maximum score are 10. So biophysical profile used to real-time ultrasound technology to assess for fetal well-being, right? And the scoring, I said, each has a possible score of 2 and maximum is 10. So the fetal get usually 0 or 2 for below the areas. The score of 8 to 10 is a normal score. The score is less than 8 indicate the fetal asphyxia. So 5 assessment tests to determine fetal well-being. I said the score if 8 to 10 indicate normal. If the score less than 8 indicate fetal asphyxia. So also in some terminology, it is good to know. It is called reactive fetal heart rate or fetal breathing abnormalities, gross body movement, fetal tone, and amniotic fluid volumes. So we have to find it out by biophysical profile test. So now we are going to most important test is called contraction trace test. Contraction trace test. What it is? What are the indication of it? What are the interpretation of contraction test or what are the complications, right? And after the contraction test rest, we should go for non-stress test. Both are important, and we are going to talk about this. So let me show you the contraction test first. So what wrote here? Assess the fetal heart rate response to contraction. Fetus should not have late deceleration in 10 minutes. So contraction test, more invasive test used to measure the fetal heart rate in response to the contraction, right? Let me recap it. So contraction stress test are the more invasive test used to measure the fetal heart response to the contraction. It's like if we nipple stimulation or oxytocin used to induce the contraction, right? So this test we do to assess the fetal heart rate in response to contraction. So how we have to start the contraction? Nipple stimulation or oxytocin used to induce the contraction. What are the indication of contraction stress test? It is non-reactive stress test or high risk of pregnancies. We should do this test. An interpretation of this test is very important. Most of the students do get confused. So when the contraction stress test is negative, it means this is the normal. So if it is negative is a normal findings. No late deceleration or fetal heart rate with 3 contraction in 10-minute period. If the contraction stress test is positive, it indicates abnormal findings. So if contraction test stress is positive, I said, indicate abnormal findings. So let deceleration present in 50% or more. 50% or more of contraction indicate of uteroplacental insufficiency. The contraction stress test have some complication, like contraction lead to premature preterm baby. Contraction lead to the preterm baby. The next test here, it is called non-stress test. So what it is and what are the indication of this test, or what are the interpretation of non-stress test? So non-stress test, basically non-invasive test that measure the fetal heart rate in response to fetal movement. So this test is performed during the 3rd trimester. Non-stress tests are performed during third trimester. So this test that measure the fetal heart rate response to fetal movement. So fetal heart rate should accelerate 10 to 15 beats per minute in 10 minutes in response to the body movement. So indication of non-stress test are decrease the fetal movement. If the fetal movement is decreased, this is the indication of the non-stress test. Or diabetic mother, or gestational hypertension, or post-maturity. So post-maturity, gestational hypertension, gestational diabetic, or decrease the fetal movement are indication of non-stress test. So what are the interpretation of the result? So if the non-stress tests are reactive, it is indicate normal findings. So if the non-stress test is reactive, normal findings means fetal heart rate has a normal rate or moderate variabilities, and accelerate is more than 2 times in 20-minute times of period, or accelerate is 10 to 15 beat within 10 minutes in response of body movement. If the non-stress test is non-reactive, it means abnormal findings. So non-reactives means fetal heart rate does not accelerate sufficiently with the fetal movement, and further assessment needed. Let me compare and contrast in between these two tests, contraction stress test and non-stress test. Interpretation only. I said if the contraction stress test is negative, it indicates normal findings. Means no late deceleration of fetal heart rate with 3 contraction in 10-minute period. If the contraction stress tests are positive, indicate abnormal findings. Means late deceleration present in 50% or more of contraction and indicate of uteroplacental insufficiency. Whereas the non-stress test interpretation, when it is reactive, means normal findings. Fetal heart rate has a normal rate or moderate variabilities and accelerate more than 2 times in 20-minute time period. And non-stress test, if non-reactive, indicate abnormal findings. Means fetal heart rate does not accelerate sufficiently with fetal movement, and further assessment needed. So this is the very basic information about the maternal newborn nursing.